Take it away.
Okay, so before I start, I'm asking everybody to put their hands in this position. We're going to hold this for 1 minute. That's going to be the first screening we're going to do. First, we're going to talk about nerves. The nerves for your arms all start at the back of your neck. They go under your collarbone and down the arm. By the time they get down the arm, they kind of are more distinctive.
You're on slide 2.
Okay, so the nerves have 2 major jobs. They give sensation, and they also are the power cords for muscle. Normally, if you have a problem with the nerve, the sensation is going to be disrupted first, and then the muscle might actually die, as you can see from the picture in the bottom with this
Slide 3.
I'm going to come out of that position. If you have any numbness in your thumb, you probably have some carpal tunnel. We're going to be talking about 2 different types of nerve injuries today. We're going to talk about carpal tunnel, which happens at the wrist.
Slide 4.
Oh shit! I can't see the slides. Ah! Okay, so carpal tunnel gets its name from there's a ligament on top. There's tendons and nerves that run through the middle. When those nerves are either irritated or stretched, you're going to get numbness in your finger and eventually death. If you're having some numbness now, what you want to do is think about how often you can keep your wrist straight. You're going to try to splint when you're sleeping and make sure you're not putting a lot of pressure on your wrists when you're typing. I can't tell what slide I'm on, so I'm just going.
You're about to go to the next one. I stopped it for a second to let you catch up. I cheated.
Which slide am I on? What does it say?
You're now on nerves like heat, cold.
Ah. Okay, so nerves like heat rather than cold. Don't use a stress ball if you're having carpal tunnel. All that's going to do is make the tendons more inflamed. It'll actually take up more space in the carpal tunnel itself, which could actually make the carpal tunnel worse. The next nerve we're going to talk about is called cubital tunnel. This is actually at the elbow, and whereas the carpal tunnel gives you numbness at the thumb side, cubital tunnel gives you numbness at the small finger. So for this screen, go ahead, bend your elbows and touch your shoulders. We're going to hold that for a minute and see if you get any trouble with that. So normally you want to hold this position for a minute to see if it's a positive screen for it. If you are getting any numbness, come on out of it. And if you are getting any numbness, the biggest thing you need to avoid is keep staying in this position. And even worse, if you're leaning on your elbow, you're then stretching the nerve and actually compressing at the same time.
What slide would you like to be on now?
So I'm on avoid this, stretching and compressing the nerve. And I'll go to number 9, sleep with elbow straight.
Okay, we're there.
Okay. So
I'll do it manually. So
let's do that. I'll tell you next slide. This won't be 5 minutes. Sorry, guys. Okay, so if you're getting numbness in your small hands and your small fingers, not only do you not want to sit like this, you want to make sure you're not sleeping like this also. You want to try to sleep with your elbow as straight as you can. It doesn't have to be dead straight, but it's not good to have it bent very much. You also be thoughtful about how you're holding your phone, especially like in bed. If you have your elbow bent for too long and this nerve is already irritated, that's another thing that can do it. Switch slide, please. Okay, so we talked about the 2 nerves, the one that gives numbness and tingling to the thumb and numbness and tingling to the small finger. We're going to talk about 2 tendons next. First is going to be the tendon at the base of the thumb, and another one's going to be tennis elbow or lateral epicondylitis. Tendons connect muscle to bone and ligaments connect bone to bone. And this is not a nerve, so we're not talking about numbness and tingling anymore. We're talking about sort of burning pain. Okay, next slide, please. So first is Decker veins. If everybody please tuck their thumb gently inside their fist and then gently tip their finger down. If you get any pain through here, we're not holding this position. This is just a yes, no. If this hurts to do, that tendon is irritated. If it's not irritated any other time except when you do this, it's not a really big deal. But this is called Decker vein tendinosynovitis. And some of the kind of common causes for this would be like aggressive mousing. You want to think about mousing from your elbow rather than your wrist. Oftentimes, sometimes it's called new mom's thumb, often from breastfeeding or from kind of picking kids up from under their armpits. Next slide. So we talked about 2 splints now. The first one was for carpal tunnel. That one did not cover the thumb. It was a third of the way up the arm and it holds the wrist straight, keeping the carpal tunnel itself as big as possible. The second we talked about was this thumb for Decker veins, which are the tendinitis at the base of the thumb. And that one you notice actually does include the thumb. And this is just kind of giving the thumb, that tendon a break. Okay, next slide. If you do have some Decker pains or any other sort of pain in your hand that involves swelling, a really good strategy is something called a contrast bath. You put your hand in hot water for 1 minute, cold water for 1 minute, go back and forth for 10 minutes. What this does is it vasodilates and vasoconstricts, kind of creates like a pumping action. Next slide. So tennis elbow. This is another tendon problem. Its more fancy name is called lateral epicondylitis. This is the outside of your elbow. This is where all the muscles that bring your wrist and your fingers up start. So it's a pretty, it's a heavy loading area. To test for this one, you're going to hold your hand up and push down on your middle finger and to see if that gives you any pain at your elbow. And this isn't, again, you're not holding like to see for numbness, it's just if it hurts. One of the big ones you're going to do is check to see how you're typing and see if you're holding your wrists back for longer than they need to be when you're typing. Next slide. Another thing to be thoughtful about is how you pick things up if you're having pain here. Because it's a overuse of these muscles, you can use those muscles less by holding things with 2 hands and your thumb facing up and elbows bent. There's a nice gentle stretch on the top there. Don't overdo it. And the picture on the bottom is of a band that can be really effective, but actually can cause other nerve injury. So if you're having tennis elbow and you're using these, things don't seem to be getting better, stop using it. You may be making things a lot worse. Okay, next slide. Then hands-free thinking. So I have this machine that's used for biofeedback. It basically says how much muscle energy you're using for a task that you're doing. So I often will do this with people or have them typing, I'll put it on, they'll say it uses 10 units of energy. Then I have them not typing, but having their hands on the keyboard. They only go down to about 8 units of energy. It's not until they take their hands off the keyboard completely that they come down to more of a resting rate of about 4 or 5. Okay, talking about ergo for a moment. Laptops are impossible to make ergonomically sound. There's no way they can get your eyes at the screen level and your elbows at approximately 90 degrees. The cheapest way to kind of go around this is by stacking your laptop on something and then getting a secondary keyboard. Next slide. Speech recognition. Dragon's still sort of the gold standard for it. If you've used it in the past, it's much better now than it was before. It really does improve readability for your writing. So a lot of people are really concerned about losing their voice, but I've worked with authors, I've worked with lawyers, I've worked with like technical writers, all found that their writing improved by doing it. I think oftentimes people don't want to do it because they imagine it as like they have to do it all the time. I think it's not for all the time unless you lose your arms, which I've worked with people with that too. The easiest way to do it is to plan on about a 10% use. And the easiest time to use that is if there's like 1 or 2 people that you write to frequently during the day, plan on using it with those people. And then actually you can just call them before and say you're trying this new technology. Okay, next slide. Some sort of surprising big deals would be cuts on the top of the hand. The tendons are so superficial. If you can kind of see the line down the middle of the finger that crosses the knuckle, that's your tendon. And that's so close to the surface that if it gets injured, it can get scarred down. Cat bites are surprisingly dangerous. Their teeth are really, really narrow, so you can get pretty deep, but then the surface can heal up. And your body's natural way of kind of dealing with most infections of the skin is actually kind of purge it, and it's not able to do that. And that picture on the right is showing something called a mallet finger. It comes from jamming your finger. If this happens, it's not going to get better on its own. You have to go to see somebody. If nothing else, you absolutely have to splint it dead straight for 6 weeks. You cannot take it off them for a second. Okay, last slide. So hand doctors are way better than ER doctors for hand injuries. Obviously go to the ER if you need it, but I've seen some pretty tragic results from people that had hand injuries, went to the ER, and never fully recovered because of it. So if your hand is injured and if you have the option, you want to see somebody who only sees hands. Hand doctors are either from an orthopedics background or from a plastic background. It makes no difference once they become a hand doctor only. But if your doctor is a plastics and they're still treating boobs, or if your orthopedic doctor is still treating knees, they should not be looking at your hands. You should only see somebody who only treats hands. The same thing's true for your therapist. If you get injured and you go to an occupational physical therapist for rehab, if that therapist is treating knees or if that therapist is treating dementia, they should not be part of your hand therapy team. Whew, I'm not sure if that was 5 minutes and I can't see any of what your face is, so I hope you're still there, but I'm finished.
You should see their faces now. If anybody has a question, and then yes, we should do applause. You can actually just do it.
Okay.
And anyone has a question, raise their hand. Carrie Lynn, was that you? You have a question? I'm unmuting you. Don't let me do it. But she's not, you're not unmuted yet, Carrie Lynn. I don't know why I can't do it. But now you're unmuted.
All right, so my question is, how do you know the difference between carpal tunnel and arthritis?
Arthritis will never have numbness and tingling. Carpal tunnel is a nerve injury, and arthritis is a joint injury.
How do I know the difference? Isn't my elbow a joint and my thumb a joint, kind of?
I'm sorry, you cut off?
Isn't my elbow and my thumb joints?
I can't hear you at all.
She says, isn't my thumb a joint and my elbow a joint?
Of course they are. Are they? I don't understand your question.
Well, I didn't understand the response.
So if a nerve is injured, it's going to present as numbness and tingling. Arthritis does not present as numbness and tingling.
Okay, that makes sense. Who else has a question? Melissa, let me unmute you.
I saw that you mentioned the band around the elbow and tennis elbow.
Yeah.
And I know of someone who is still having tennis elbow and wearing one of those, and I'm wondering if you can go into the details of how they might be wearing it wrong.
So there's something, tennis elbow, its fancy name is lateral epicondylitis. It's a tendon, so it's where the muscle connects to the bone. Pretty close to it, but further deep, is the radial nerve. If you put anything circumferential around that part of your body, you're not only kind of offloading the muscle, you're putting pressure on the radial nerve. The radial nerve doesn't have a very strong sensory component, so it's very hard to suss out if your radial nerve is damaged, but sort of the classic presentation is, if it's lateral ep, it's right on the bone. So if it's hurting kind of right here, that's lateral ep. If you go a little proximal, and it's kind of, some people describe it more like a toothache. If it feels more like a toothache and it's not quite a real specific spot, that's probably actually radial tunnel. And the band is going to be making it worse. Kind of the good news for lateral ep is almost all of the studies have shown that regardless of what you do, it gets better within a year. It can get better faster by doing other things, but regardless of what you do, it usually gets better within a year.
Chris, I'll unmute you there.
So many years ago, a physical therapist showed me a stretch that seems to help with carpal tunnel. That's what he showed me for. It's you go like this and then slowly go down. So just on the middle two fingers. Can you comment on this? Is it a good idea in general, or am I weird?
Yeah, so the muscles that run through the carpal tunnel are the muscles that close your fist. So that stretch you're doing is sort of a lengthening them, which can be good. The only sort of caveat being, if you are stretching to such a degree that you're now irritating those tendons, you're actually just causing them to get bigger and putting more pressure on the nerve. So a gentle stretch, it can be good. I think actually a deeper massage over the muscle bellies through here is probably more effective.
Renata, I'll unmute you. See if you can unmute yourself. I can't seem to do it. There you go. Oop. There.
I don't know what that was about. So, okay, now I have two questions. Living with you was really awesome for this. I felt like I had a occupational therapist around all the time. I mean, I did, yeah, it wasn't just so thank you. So one of the things that you were helping me with long ago was stretching and nerve glides. And oh no, now I have three questions. Well, okay, I'll ask all of them. You can choose. You don't have to answer all of them. Sure. What's the difference between a stretch and a nerve glide? Yeah. The other one, you were just talking to Chris about the muscle massage. Yeah. How do you know where to do that? And the other one was, how do you know when to stop doing nerve stuff? Like, where should you stop stretching or gliding, whatever?
The first question I think maybe have the most relevance and maybe the clearest answer. So the difference between a nerve glide and a stretch. A nerve glide is sort of like, I don't know if you remember from that first picture, we showed how the nerves start at the back of the neck and they have multiple jobs kind of through the arms. But in some ways you can think of them as one sort of continuous rope and some beautiful things happen further up, but it's kind of one big rope. So if that nerve, let's say, let's go to cubital tunnel at the elbow. So this one part of the nerve that's irritated, it's injured, it's sitting in the same spot that's irritating it. So it's kind of always being chafed. It's not quite getting the blood supply that it needs. So a nerve glide should absolutely not be a stretch. Literally all you're trying to do with a nerve glide is you're trying to get the part of the nerve that's most injured outside of the place that's injuring it. By kind of, it's more like imagine more like you're flossing the nerve through some spaces. It gets better circulation once it's out of that irritated area. So there's some mixed opinions on this, but my sort of relatively strong belief on this is that if you're doing a nerve glide and you're reproducing the symptoms of the nerve being stretched, i.e. you're getting that numbness or tingling, then you're doing it too aggressively. I would, you need to back off some portion of that nerve glide. Yeah, okay, so a stretch is, so a nerve glide should never feel like a stretch, is the answer for that. Oh shit, you asked 2 other questions. Okay, so where to do the massage? That doesn't have a one answer. So depending the injury, massage is going to sometimes even be the wrong choice to do. So I don't think there's a one answer for where to do massage. For carpal tunnel, we know it's the muscles that sit here become tendons through here. If you can get these tendons a little bit happier, sometimes they kind of actually shrink a little bit, so they take up less space. So by massaging this muscle, you kind of take some tension off of here. For lateral ep, you actually want it, for the tennis elbow, you want to do the opposite kind of side of the arm. You want to do those top muscles, because then you actually are making them physically longer, so they pull less from the elbow. For nerves, you don't want to massage on a nerve. That would be unpleasant and unhelpful. Sorry, was there a third question? I can't remember it. I'm sorry.
I'm unmuted. When you're, no, I think you answered all
Okay.
When you're doing it up here, is it like, so you've got the 2 wrist bones or
Okay.
something, you know, whatever, you probably know what those actually are. Are you massaging like on that same plane?
Okay. Even that probably doesn't, people do have opinions on it, but the fact that people have multiple opinions on it kind of show that none of them matter too much. If it's for making the muscle physically longer, it feels good when you do that massage. So if the massage feels good, you're probably doing it right. If you're getting more symptoms from doing it, you're probably doing it wrong.
Okay, any other questions?
Did you want to talk more about arthritis? It sounded like at the beginning I didn't quite get to answer your question right.
Carolyn, you're on mute.
Well, talking about arthritis is a different topic than what you're doing. I just didn't know what, I mean, you answered it with the numbing and tingling. So if you have pain, then it's not carpal tunnel, it's arthritis. So that's a whole nother day, I'm guessing.
Yeah.
Okay, any other questions?